Hi all, my name is Alfredo Martinez. I will be presenting on exercise addiction. What is exercise? Exercise is physical activity that is planned, structured, and repetitive for the purpose of conditioning any part of the body used to improve health and maintain fitness. A few benefits of exercise: it reduces stress levels, increases energy levels, mood, self-esteem. It improves sleep, increases confidence and well-being, and improves weight management. But can too much exercise be harmful? Yes, it can. What is exercise addiction? Exercise addiction is a type of behavioral addiction similar to gambling, internet addiction, social media addiction, and gaming, video gaming addiction. An individual who is addicted to exercise will continue exercising regardless of physical injury, personal inconvenience, or disruption to other areas of life, including marital strain, interference with work, and lack of time for other activities. Addicted exercisers are more likely to exercise for intrinsic rewards and experience disturbing deprivation sensations when unable to exercise. And an analogy of an exercise addict is that similar to an alcoholic who continues to drink even after the desired stress relief from alcohol has occurred. Uh, Pharmacological considerations of exercise. Um, the frequency: 18 to 64-year-olds should exercise a minimum of 30 minutes a day, 5 times a week. And the methods of exercising are aerobic, strength training, stretching, and balance. Aerobic being an exercise which speeds up your heart rate and breathing. It is important for many body functions. It gives your heart and lungs a workout and increases endurance. Uh, in addition, aerobic exercise also helps relax blood vessel walls. It helps lower blood pressure, burn body fat, lower blood sugar levels, reduce inflammation, boost mood, and raise good HDL cholesterol. And examples of aerobic exercise are brisk walking, swimming, jogging, cycling, dancing, or classes like step aerobics. Zumba is a great one. Not that I've tried it. Um, Second one is strength training. Um, Strengthening your muscles not only makes you stronger, but also stimulates bone growth, lowers blood sugar, assists with weight control, improves balance and posture, and reduces stress and pain in the lower back and joints. Um, Strength training um, can involve doing bodyweight exercises like squats, push-ups, pull-ups, lunges, and you can also throw in resistance strength training from a band, or weight machine. Third one, stretching, helps maintain flexibility. Stretching the muscles routinely makes them longer and more flexible, which increases your range of motion and reduces pain and the risk for injury. And lastly, balance exercising. Improving your balance makes you feel steadier on your feet and helps prevent falls. And some of these exercises can be Tai Chi or yoga. Physiological aspects. There's a release of endorphins, stimulation of dopamine, norepinephrine and serotonin release. And what most exercisers look for is the or get is the adrenaline rush, which makes them want to exercise more and longer to get that pump. But there's also symptoms of exercise addicts, similar to those of people who may be addicted to drugs. First one being tolerance, needing more and more of the initial activity to achieve sought after effects. Second, withdrawal, ensuing anxiety, fatigue, irritability, or other unenjoyable emotional and physical experiences on days when one is unable to work out as planned. Intention of effect, repeatedly exceeding planned upon limits to the amount of time spent exercising. So they end up exercising for a longer period of time than one had originally planned on. Lack of control, experiencing one's physical activity habits as difficult or impossible to keep at manageable levels. Time, far more time is spent exercising than is recommended by medical or fitness professionals, and planning, engaging in, or recovering from physical activity consumes a noticeably large portion of one's days and weeks. So the majority of the day is spent doing exercise. Um, that's what it's consuming uh, the majority of the person's time. Reductions in other activities, social, work-related, and leisure endeavors are sidelined to prioritize fitness, often to the detriment of one's emotional and interpersonal well-being. As I mentioned earlier, um, this has a negative effect on the people that are around a person who is addicted to exercise. Um, it can be friends, family, um, coworkers, their kids, their spouse. Um, it's not just the person that is addicted to the exercise that is getting negative effects from it, but the people around him or her as well. And lastly, continuance. One persists in physical activity despite illness, injury, negative psychological outcomes, or medical advice to taper down or take a break. So a person is exercising even though they have been told to stop um, because they may be ill or may have a serious injury. I've seen many people in gyms working out. They have a boot on. Um, I've seen people with a cast. I've seen people work out that have a sling. Um, so there's plenty of people out there that push it uh, beyond the limits and beyond the recommendations of a medical professional. Psychological aspects. Um, it alleviates long-term depression, specifically unipolar depression. It's a tool for treating and perhaps preventing anxiety. Exercise may be a way of biologically toughening up the brain so stress has less of a central impact. And along with exercise addiction, there is an association of eating disorders. The first one being bulimic nervosa, which is a serious, potentially life-threatening eating disorder characterized by a cycle of binging and compensatory behaviors such as self-induced vomiting designed to undo or compensate for the effects of binge eating. And there's also anorexia nervosa, which is an eating disorder characterized by weight loss or lack of appropriate weight gain in growing children. Difficulties maintaining an appropriate body weight for height, age, and stature, and in many individuals, distorted body image. People with anorexia generally restrict the number of calories and the types of food they eat. Some people with the disorder also exercise compulsively, purge via vomiting and laxatives, or binge eating. And anorexia can affect everyone, males and females, and children included. And lastly, orthorexia, I learned about throughout the research or my research for this presentation, and it is an obsession with proper or healthful eating. Um, Although being aware of and concerned with the nutritional quality of the food you eat isn't a problem in and of itself, people with orthorexia become so fixated on so-called healthy eating that they actually damage their own well-being. So they're very concerned about the types of food that they are eating and where it's coming from, the quality of it. Is it organic? Is it grass-fed? Is it wild caught? Things like that. In addition, I also added some eating disorder statistics for the United States. Some surprising numbers that, as you can see. And lastly, I added some resources for treating exercise addiction. Um, these resources were made up by Jenny Schaefer and with the help of the Harvard Medical School, and involves articles, books, websites, great resources for people that are trying to get or move on from exercise addiction.